Michigan's state-run psychiatric hospital system is broken. And sadly, the more I've learned, the worse it gets. The State Auditor General has confirmed what too many patients and families have told me. Those who turn to our state for care are most vulnerable. Our kids, our loved ones, have not been protected as they deserve. Colleagues, I personally placed a copy of the audit on your desk for you to read and review. 6 months have passed, and no action by this majority has been taken to protect our kids and adults in the state's care. My calls for hearings went unanswered, and my bills to correct many of these concerns have remained in committee collecting dust. Instead of action, all we hear are excuses. Some want to blame the federal government for our problems. Some want to blame the Michigan House for our problems. But true leadership requires something more. It means looking in the mirror and asking why we are not protecting the kids and adults receiving mental health care under our supervision. Why has the majority refused to hold the Michigan Department of Health and Human Services accountable? When the state accepts responsibility for those in psychiatric care, it accepts a sacred trust to defend their dignity, to protect their rights, and to act swiftly when those rights are threatened or violated. The Hawthorne Center and all of our state hospitals must be places of healing, not fear, not chaos, and certainly not abuse. We've seen hearings and public events from this majority focus on protecting various rights in other contexts. At the same time, this majority has ignored the rights of our kids and vulnerable adults in our state's care. That's unacceptable. We are failing vulnerable kids and adults. Director Hertel and her leadership team have not demonstrated the urgency this mental health care crisis demands. The department has demonstrated a troubling willingness to ignore current law and its own guidelines for protecting patients. Oversight is not optional. Accountability is not a suggestion. The department has failed to protect our most vulnerable seeking mental health care. Michigan residents deserve a patient protection system that upholds and protects their rights. And they deserve this chamber to rigorously scrutinize and correct the department's failures. It's incumbent upon all of us to meet this moment and fulfill this responsibility to protect our most vulnerable.